Hi everyone, Dr. H here with 𝒕𝒆💂💂. I'm here to show you another way that we help patients with their headaches. It's another way, another technique that we use in our office, and that is called the toggle upper cervical technique. Sometimes when we have patients who come into our office, we actually do not like the audible sound that what people call the pop, right? Sometimes it scares them, sometimes it just kind of it's just not pleasant for some patients. But that's actually the pop is just a myth. Actually, what's in there is that just the nitrogen gas gets built up in the joints, and when we deliver the adjustments, the nitrogen gas gets dispersed into that joint, and that's where you get the audible sound. But we have other techniques that we use here in our office to adjust, and this specific one is called the toggle upper cervical technique. And this specific technique is very specific to the upper cervical, especially the C1 and the C2, the first two the vertebrae of our spine. After doing my assessment and checking exactly which segment and which side that needs adjusted, what we do is actually have the patient lay on their side just like this, okay? And we raise this this drop piece. This drop piece actually comes up, okay? I'm just gonna angle the patient just right there, very good. And this drop piece actually comes up just about a quarter inch or so, okay? And I've already done the pressure check on it for this patient, because our head weighs about 10 to 12 pounds, and sometimes we have to make sure that there's the right pressure on this to make sure that the adjustments get delivered correctly. So what I do is actually come up to the bump, right? That it's called the mastoid bone right here. I come in right under there. That's where our C1 actually is. So I come in right down here, and I find that the contact point, that C1. So as soon as it comes down, it's right there, okay? And the way to adjust this using this technique is by small little contact point here called the piezoform, okay? So back here the C1, and we're going to go to the piezoform right there, okay? I'm going to have the patient go ahead and take a deep breath. And all the way out, and I just follow right through there. Okay, simple as that. There's no audible, and it's just very quick and very efficient adjustment to kind of help get rid of the headaches.